Hi friends, today we are going to talk about mood disorders such as depression, anxiety, sleep problems, and other in the content of inflammation in the small intestine. So those symptoms are secondary because person has an inflammation in the small intestine. And in a few words, I will tell you later how to manage those symptoms temporarily at least. This video is continuation of previous one on 9A, where I said small intestine, when there is inflammation there, you can have following symptoms because small intestine is responsible, and the symptoms will be mood disorders such as depression and anxiety. And in the same video, I said, this on the left is a normal villi, so small intestine, excuse me. And this villi with scripts, and this, when there is inflammation, those villi get slashed. As a result, when there is inflammation and villi are slashed, those cells, neuroendocrine cells, they get slashed, cells are lost. As a result, neuroendocrine cells, the quantity of neuroendocrine is diminished. As a result, we produce less hormones, including serotonin. As a result, we will have consequences with the mood. So here is on the left, serotonin is responsible for depression, anxiety, sleep problem, digestive, suicidal, blah, 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 blah. Now, how to deal with those problems, at least temporary? And the way to do that is take supplements. Here on the right, you see biochemistry. When we take L-tryptophan, amino acid that we take inside, we eat with the food basically. L-tryptophan converted to 5-hydroxytryptophan, and then it converted into serotonin. And the serotonin, manages manages our health, such as mental health, such as depression and anxiety. Eventually, it's get converted into melatonin that is responsible for sleep. So looking at this chemical pathway, you understand what kind of supplements you may take. Look at that. So first of all, you can eat just the food that's full of L-tryptophan. Milk has 732 milligrams per quart. I love canned tuna. It has 472 milligrams per ounce. So, and you go through this list and you try to incorporate those foods into your diet. The higher concentration in the food, the better it's going to be. Supplements. Here is one of the examples, essential amino acids. And you can see here, tryptophan is 37 milligrams. I would say this is not a good supplement, okay? You need to take 3 capsules to get 37 milligrams of L-tryptophan. Eat your turkey. And we all know that when we eat turkey for Thanksgiving, the next 2 days we are sleep so good, right? So you also can take 5-HTP, basically this one, 5-hydroxytryptophan. So, and it says here, right on the back of the label, 5-hydroxytryptophan, 200 milligrams, and you need to take only 1 vegetarian capsule. So I like it much better. You also can take melatonin if you feel that you have only sleep problem, this one at the end of this chemical process. Now, I will, by the way, this is my contact information, and I do coaching sessions, so please contact me about that. I want to say a couple of words. People often ask me, oh, how do I know that I have inflammation in the small intestine? The way you know is clinical symptoms. If you have gas, bloating, constipation, diarrhea, or both constipation and diarrhea, like in irritable bowel syndrome, the answer is you have inflammation. People say, oh, how I need to confirm it. Unfortunately, at this time, there are no ways to confirm that. So we can do gastroscopy and look at the stomach, but we cannot look at the small intestine. We can do colonoscopy, we can look at the large intestine, but the small intestine, you just cannot reach there just because it's too far, right? There are no good laboratory tests. Actually, there are no tests at all to see how much serotonin you are making. Well, we can do that, but not very good. So here's what I suggest. The step number 1, while you're taking supplements, let's suppose you eat some food that has L-tryptophan, and you decided to take a couple supplements for that and see if it's working for you. You have to address underlying problem in the small intestine. What could be underlying problem? People take ibuprofen high doses, right? You create an inflammation. People took antibiotic that created dysbiosis, and dysbiosis created inflammation in the small intestines, gas, bloating. So take probiotic. Food sensitivity, like dairy, for example. So eliminate, experiment, and in the meanwhile, take supplements and see if there is a clinical improvement. Okay, guys, that's it for today. Thank you very much. Like, subscribe, bye-bye for now. All relevant information in the description below.